Hello and welcome to The Arise interview, where we take time to reflect on the big stories from the news and on the fortunes and affairs of the world in an hour of conversation with commentators, analysts and thought leaders. I'm Charles Anyegolu. Coming up in the next 60 minutes, the US makes a surprise announcement. President Joe Biden has given the thumbs up to waive intellectual property patent rights protections for Covid-19 vaccines. But what will this mean globally, including in India, dealing with a devastating, deadly second wave? They lobbied the WTO with South Africa. So could the jab be made in Nigeria and all around the world? Does Africa have the technical capacity to start producing coronavirus vaccines? We'll talk to you and take you through the medical, technological and political implications in a moment. And later, the global pandemic has changed all our lives and will continue to do so for years to come. But for people living with physical challenges, the problems have been big, from loss of essential services and support to abuse and a lack of understanding of their needs in public spaces. We'll speak with the founder of an NGO for women with physical challenges and try to understand what COVID and lockdown have meant for her work and the people she represents. Coming up. Now, in the US, the Biden administration says it supports waiving intellectual property protections for coronavirus vaccines, a major breakthrough for international efforts to suspend patent rules as the pandemic rages in India, South America and elsewhere. There's been growing pressure on the world's richest nations to share their vaccine stockpiles with nations that are less well off in order to bridge the scale of the vaccine gap. The issue was discussed at a meeting of the G7 group made up of the wealthiest countries in the world. Well, now, after the American announcement, the World Trade Organization's members must all agree for the patents to be waived. The EU has said it's willing to discuss the proposal, but the US decision to back a waiver has been labeled disappointing by an international federation of pharmaceutical companies.
What we're seeing in South Africa and India is, of course, heartbreaking, and there are many factors at play there, both in terms of the management of the disease, the availability of vaccines, availability of therapeutics, oxygen, and many other things. I think that the point remains is, globally, we have got a production level of around 10 billion doses of vaccines. And there's a lot more that we need to be doing to make sure that those vaccines are equally distributed around the globe. We're really committed to working with all governments and the multilateral organizations, particularly through COVAX, to make that happen. And our genuine concern is that the IP waiver, although well intended, will lead to a slowdown in production and also a lack of long-term confidence in the investment we need to keep vaccines going for the future as well, including for new variants. Price is not the factor here. These vaccines are all fundamentally pretty affordable, and certainly in comparison to the many more billions that have been spent on test and trace, and certainly over the costs of COVID around the world. I think money really is a red herring here. The private sector does need to have intellectual property rights and a profit motive to keep going. And to be honest, it's really fortunate that we have had the profit-making pharmaceutical industry that has been available and has been able to throw its weight globally behind vaccines manufacturing right across the board. Without it, we would not be where we are today.
Well, to discuss all this, I'm joined now in the studio by the immediate past national chairman of the Nigeria Association of Academic Pharmacists, Professor Martin Emeje, who's also the head of research and development at the National Institute for Pharmaceutical Research and Development, the Nigerian government agency charged with the development of drugs and vaccines, and by Dr. Akyala Ishaku, who is a molecular virologist and epidemiologist and senior lecturer in the Department of Microbiology at Nasarawa State University in north-central Nigeria. Gentlemen, thank you very much indeed for coming in. Let me start with you, Professor Emeje. What do you make of the news that Joe Biden has given the green light to this waiver about COVID vaccine patents?
There's nothing to be excited about. I don't think there's anything to be excited about. And why? Because are you surprised that it is India and South Africa that demanded for the waiver? Why do you think it was India that demanded for a waiver? Why didn't Nigeria go to demand for a waiver? So what are we getting excited over? The people who have the capacity and the political will, the willingness, the readiness, who respects research and are ready to do, and they know that on this issue, because it is new and because it is currently devastating their society, their own rate limiting step, the major obstacle they have is how to assess the technology. So they started pushing for that. In fact, if not that COVID-19 is devastating India, give India some few years and we do reverse engineering and start producing all these vaccines.
Well, obviously, you don't think that about Nigeria. And you work in the government agency that's charged with developing vaccines and drugs for Nigeria. You clearly don't have the confidence in that.
I'm not discussing abstracts or confidence here. I'm discussing realities. I don't speak to the air. I'm a pharmacist.
Sure.
I'm a professor of pharmacy. And this, when it comes to skill, the know-how, that's not what our country lacks. And I'm sure as a journalist, you have heard so many times, and you are one of those journalists anyway, that our own resource is human capital. That we can stand shoulder to shoulder with any country in the world, okay? So the leadership question is a big issue because that is where everything revolves. That's what is responsible for deployment of what we need, the infrastructure that is needed for utilization of skill. In fact, I always say that Nigeria suffers from low capacity utilization of its own human capital.
Okay, we'll come back to you in a minute because the line that you're taking there is a very interesting and very revealing one. But let me bring you in, Dr. Ishaku. Thank you very much indeed for joining us. What's your reaction to that American announcement that it's going to support moves to waive sort of protection for patents on COVID vaccines?
Yeah, thank you for having me. Let me align my thoughts with my senior colleague in the field of sciences. And I think that to some extent, we are not supposed to, celebrate this. But on the other way around, looking at the coin as a legal tender, I think it is a good news. This is because it will lead to knowledge transfer, one. It will also lead to equitable distribution of the vaccines. So I strongly believe that it is coming at the right time. But I think the WHO too has opened a window for this. They have a COVID-19 intellectual pool, access pool, where countries can be able to access intellectual property. So I think by and large, the only demerit of this, the disadvantage of this in the field of sciences is that some people argue that it's not going to promote innovation. And then a lot of people are not going to actually pump in resources into research. So a lot of pharmaceutical companies will go bankrupt because they feel like their intellectual property is not being protected, and so it is being waived. So I think I agree with my senior colleague that one of the things that we lack in this part of the world in Nigeria is that our ability to harness our human resources, which is quite key. If you go to Yale University, if you go to Harvard, if you go to even Moderna, people that are championing the production of COVID-19 vaccines are Nigerians. So I think that one of the major components that we have is the type of the political will to drive this process. I was thinking by now that we would have had a presidential initiative to actually a vaccine, not only COVID-19, vaccine presidential initiative as a policy to actually drive this process by upgrading platforms like in NIPRIT, upgrading platforms in NIPRIT and other sister institutes for us to actually go into production of vaccines. So it bounds back to political will and also our inability to have a leadership that can be able to harness the human resources that
let
we
me
have.
bring you back in, Professor Emeje, because obviously all these will involve trade negotiations at the WTO. It'll take time, so it's not like they're going to wave a magic wand and have sort of vaccines appear in factories around the world tomorrow. But let's say that it all does go ahead. The patents are waived and all of that. How quickly could a country like Nigeria then start producing its own vaccines? Does it have the capacity to adapt itself to do this? Does your agency, the National Institute for Pharmaceutical Research and Development, have the capacity to do that?
Okay, I'm going to do some explanation, but let me quickly respond to
but
this,
if I have
that
to
my agency...
because we may take a break, but we'll come back and you will continue after the break.
no
So go
breaks.
ahead.
First of all, let me just respond quickly to that. Does your agency has the capacity? The answer is yes. And we have the skill. In fact, my Director General has already approved a National Advisory and Scientific Committee for COVID-19 vaccine.
Right.
Yes, and it is made up of academics and captains of industry, covering the entire nation, And I can also tell you that two countries, Russia and Cuba, are already discussing with us on how to make sure that we are able to have local manufacturing capacity here in Nigeria. My institute has a pilot plant, built more than 20 years ago by UNIDO that has that has done some pilot scale-up and proof of concept for development of this kind of products.
So it's not the capacity, it's the political will that you're talking about.
Oh yes, I can tell you that, and that's why I'm telling you that the trajectory we have taken now, we are no longer going to wait to say government. We are always talking of government because that is even government that is ready to do something, because the private sector does not even do anything.
Okay, and let me ask you to, I apologize to interrupt you. We'll come straight back to you, but we must go to the market, I'm afraid. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the surprise US announcement that it wants to waive intellectual property protections for coronavirus vaccines. Stay with us. Welcome back to the Arise interview. I'm Charles Enyekolu. Now let's continue our chat about the debate on how to get more COVID vaccines to poorer countries, a subject that's been concerning world leaders meeting at the G7 Ministers Summit this week. Well, US President Joe Biden has said that these countries should be allowed to make their own copies of the vaccines and not pay drugs companies for the rights. His call has been welcomed by the World Health Organization, with the Director General calling it a monumental moment in the fight against COVID. Well, India and South Africa were the leading countries pushing for that change, but there are also some 60 other countries, including Nigeria, that have been supporting that push.
We sincerely hope that the US has shown its leadership by supporting this proposal, and they will continue that support in good faith to have a outcome which serve its rational and purpose. By these US is a vindication of India's stand. So it shows that there is a merit in the argument, and as I said earlier, that it gives a kind of now a moral authority for India to take measures at the domestic level. So, okay, India need not wait for the WTO decision to come. Before that, India can take certain measures to address the IT barriers in order to enhance the supply of medical products required for COVID response. The adoption of this decision will not change the ground realities on the day one, but it will pay for the changes on the ground slowly but quickly compared to the earlier days, okay, where you have a legal barrier. You have to come around that legal barrier. Once that legal barrier is moved, rest of the things you can put it in place through governments can take actions, government can take various measures to put that thing in place.
Australians there reacting to Mr. Biden's thumbs up for the COVID vaccine patent waiver. And with me in the studio, the immediate past national chairman of the Nigerian Association of Academic Pharmacists, Professor Martin Emeje, who's also head of research and development at the National Institute for Pharmaceutical Research and Development, the Nigerian government agency charged with the development of drugs and vaccines, and by Dr. Akyala Ishaku, a molecular virologist and epidemiologist and senior lecturer in the Department of Microbiology at Nasarawa State University in north-central Nigeria. Gentlemen, thank you very much indeed for staying with us. And we'll come straight back to you, Professor Emeje, because you were making the point about how Nigeria would handle this situation if the waiver was put in force today.
Yes. First, let me connect what I was saying earlier. I said when you hear public institutions talk about government, the need for government support, it is because it is a responsibility of government to do so. But I want you to look at the therapeutics or vaccines that are out there today that even Nigeria is using. They are mostly sponsored by private industries. So the private sector has a huge role to play in supporting research and development. They don't do that in Nigeria. It is something that we have to do if we move forward. So even if you remove patent for the current COVID-19 vaccines, what will happen?
But is that the fault of the private sector? Or is it the fault of the government agencies that don't market themselves in such a way? Because, I mean, the private sector is there. They're producing a lot of things. They're making a lot of things. And they just don't have the confidence that these government agencies can do what they say they're going to do. And you don't sell yourselves very well, do you?
Okay. Is there patent to paracetamol?
Well, I wouldn't know.
There is no patent to paracetamol, but paracetamol is not made in this country. So who is talking about patent has been the problem?
Yeah, but why can't you make it?
I
mean, you're the government agency.
It's not our responsibility to make drugs and go to the market. We have, and I've just told you that we have a pilot plant scheme where this can be done. Now, when it is done, it is called a proof of concept and then go to the market. Who goes to the market? The pharmaceutical industry. So that was why when we finished with Niprisan for sickle cell, a Nigerian company has gone to market with it. We have another 10 other products that no industry
and then someone else develops.
Exactly. Oxford University.
It says your research
Oxford University is not the one that has sent vaccine to Nigeria.
Right.
It is the Indian Serum Institute.
Right.
That's a manufacturing company. That's a pharmaceutical industry. Right. But Oxford University is the research component of that development.
But isn't it up to you as the research and development agency of the government to encourage the private sector to come into that thing and do the work? In other words, you do the research, you do the development, you say to them, come forward, these are the incentives, this is the potential, run with it.
It is not we are not the ones to encourage the industry. Right? We are all Nigerians. Now, if we take malaria, for example, and we have the need to have a product to take care of malaria, both government and private sector, Nigerians. We are just classifying them because one is government, one is private sector, but we are all Nigerians. Okay, well, the malaria is dealing with all of us. Right. So we should all be interested. Nobody is supposed to sit down somewhere and be waiting for someone else to come and encourage you. Who encouraged us to go and get AstraZeneca Oxford University vaccine? Who encouraged us? Did AstraZeneca encourage us? We went to beg. So what are we talking about encouragement?
AstraZeneca developed it and made it public, and so people went
exactly the way we make our products, we do our research, develop our concepts, and make them public.
Right. Okay. Well, let me bring Professor Ishaku in so that we don't obviously have the conversation one way. We have a sort of multi-discussion here. What's your reaction to all of that?
Yeah. So I strongly believe that there is a role of the private sector in driving innovations in sciences, basically in innovations in all spheres of life. Just like the way he said, we need an agency to actually do research in the products, and then also has the ability to tell the private sector that, yeah, you can come for the patent. Absolutely. And then, you know, but I think one key thing that is lacking, which you have also identified, is that there is a gap. There is a gap between a lot of our institutes in country with private sector. And I think that COVID-19 should be a season where we need to close those gaps.
That's a good point, because in fact, it is because of COVID-19 that the idea of waiving patents is being considered. Absolutely. It wouldn't be considered in any other circumstance.
Yeah.
You know, the Americans would not have supported it. No, the European Union talking about it now would not. No, what I'm saying is that the reason why this was being advanced is that this is an emergency situation. Absolutely. So the idea...
There are two things that drive that.
The idea... I have to let him finish, so make the point, sorry.
Okay. Yeah, so we need to do that. And what I want to push is that our institutes in Nigeria needs to be entrepreneurial in nature. If you go to MIT in the USA, you discover that a lot of patents, every year they have a lot of patents, you know, they do patent exhibition. Yeah, so those are the things that we need our institutes in Nigeria to actually do, our agencies. So if I may ask you, should not only be limited to COVID-19 vaccines. So what happened to other vaccines? Where Lassa fever is endemic in this country. We're not talking about Lassa fever vaccine. We're not talking about malaria vaccine. We're not talking about older childhood preventable diseases vaccines. So we should open more windows to waiver of other vaccines, not only limited to COVID. This is because we need also knowledge transfer. It is quite key. At the moment, I don't want to, I'm being very optimistic and being very hopeful of this country. But I think that we need to also upgrade a lot of our platforms. A lot of our platforms might not be able to serve.
Okay, I'll tell you what, well, I'll come back to you. I've got to take another break. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the US announcement that it wants to waive intellectual property protections for coronavirus vaccines. Stay with us. Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Anyekolu. Now, the United States has backed an initiative to waive intellectual property rights for vaccines against COVID-19, a move that's been welcomed by numerous health organizations around the world. As you may know, many poorer countries around the world are struggling to get COVID vaccines, so the news that the US President Joe Biden says they should be able to make their own copies free of charge should come as a huge relief. The World Health Organization describes Mr. Biden's announcement as a monumental moment in the fight against the coronavirus pandemic. And with me in the studio, the immediate past national chairman of the Nigeria Association of Academic Pharmacists, Professor Martin Emeje, who's also head of research and development at the National Institute for Pharmaceutical Research and Development, the Nigerian government agency charged with the development of drugs and vaccines, and by Dr. Akyala Ishaku, a molecular virologist and epidemiologist and senior lecturer in the Department of Microbiology at Nasarawa State University in North Central Nigeria. Thank you, gentlemen, for staying with us. And let's come straight back to you, Dr. Ishaku. You were making a point before we went on break.
Yeah, so absolutely. So there is need for us to invest in research, research and development. And that is why the 21st century is about converting knowledge into products. And that's why you see a lot of people invest in research. You know, multinational companies invest in research. And I think that it is time for us to also open windows for people to actually invest in research. So in the coming years to come, months to come, I expect multinational companies like Dangote to actually, you know, invest. I'm just giving an example, to invest in research. Give grants to NIPRIT, you know. I expect Nestle, I expect some great companies, multinational companies, to actually fund research. If we have the political will and the leadership, I expect TED Fund to actually open its window of opportunities to a lot of research institutes to be able to do that. So we need actually to see where we can close gaps between the academia and the industry, because this is a very huge gap in Nigeria. And that's why you could see professors of mechanical engineering still take their cars to roadside mechanics instead of having a workshop for themselves. That is why you can see professors of electrical engineering, we still import bulbs, you know. We have professors of mechanical engineering that are gearbox of our cars are breaking down in this country, and we could not see the reasons. This is because there's a huge gap. It's more like we based on theories rather than skills acquisitions and how to make our universities entrepreneurial in nature. Texas State universities declare profits.
So obviously it works both ways, doesn't
absolutely.
it? I mean, you could be sitting there, I'm not saying you are,
Yeah.
but you could be sitting there waiting for someone to come and give you a grant, but you could also go out and find those grants and do the research and,
so it bounces back to leadership.
Yeah.
How many state governors you see in their
Yeah,
budget?
but we're not just talking about political leadership. We're talking about leadership of the organizations as well.
Absolutely.
Where they the leadership of the universities.
Absolutely.
Where you can pursue grants for research and so on.
Of course,
without
the leadership,
necessarily waiting
the government,
for somebody else
so
to do
let me
it
just
for you.
round up by saying that the leadership of the government is actually a key driver to this. I
agree.
I asked you how many state governors in their budget have kind of an allocated budget for research, even in their own state universities.
Okay, well, let me move this on to another level, because we could dwell on this forever. And the key point here is that there is a COVID pandemic raging around the world. Potentially, Nigeria could experience a third wave, which could be devastating. And the way to stop that from happening is by getting people vaccinated as much as possible now to prevent it from taking place. You mentioned earlier, Professor Emeje, that the agency that you work for, NIPRD, which is the government's agency charged with development of drugs, vaccines, research, development, all of that sort of thing, that it has the capacity to do what is needed to get these vaccines out. So given that, in terms of what needs to be shared by the vaccine producer countries, they have to share not just the scientific information, but also the technical know-how, which is the actual production information. Is that what you need if you were called upon today to develop those vaccines?
If we are called upon today to develop the vaccine, we already have the concept, we already have all that is needed, that it should be done. You see, because what we need is the platform to do a proof of concept and then move to the industry. Okay, and I can tell you that that is not lacking even in Nigeria. And I can give you an example of many professors, even in Nigeria, in Nigerian universities, who already have that platform, and they are waiting for the industry to support it.
What I want to be very clear on, because this is very important, is does Nigeria fall into the category of nations that have the production ability, where once the information is shared, they could produce vaccines relatively quickly?
No. Production of vaccine itself is the duty and the responsibility of the pharmaceutical company.
Right.
As we talk today, no pharmaceutical company is ready. None.
That's an important point.
None. So that's why I was telling you that as we talk today, scientists in Nigeria, Nigerian scientists, you know, one of our own biggest problems is that we also don't respect ourselves. If not, Nigerian scientists know what to do. Some from Sokoto to Redeemer to Abuja at NIPRD to VOM, scientists already have platform. And it's not today. We know this. We've been doing this. Nigeria is one of the most respected countries when it comes to veterinary vaccine. Why? But is it developed?
Right. So let me just be clear, because we're going to run out of time, and I want to get to certain things. I'm afraid not. We've got someone else waiting to come on. Does it need? So in other words, Nigeria needs to stand up an entire factory to do this, and it could be months or even years before it can build that capacity.
Correct. If we have the kind of political will that we have when it comes to conducting election, if we take 50% of that kind of will, we build factory. NAFDAC will be ready to certify that factory to begin to make vaccines in this country and other drugs, not just vaccines. We are going to vaccine. Vaccine is even at a higher level.
And let me just,
other drugs, because we are not making any drug. Please, this is not a joke. We are not making any drug.
What you're saying is very important. And let me just remind the audience that you're speaking from a position of experience. Because not only are you the head of research and development at the National Institute for Pharmaceutical Research and Development, which deals with drugs and vaccines and development of medicines and all that sort of thing, you're also the immediate past national chairman of the Nigerian Association of Academic Pharmacists.
That is all pharmacists who teach in Nigerian universities.
So you know what you're talking about.
Oh yeah, let me tell you what we did. Responding to this, and because one of his own mentors, Professor Yakubu Ngwe, is a pharmacist in his university, and he was my committee member. One of the things we did, we said we were giving 9 months to the pharmaceutical industries and the academia, that is all pharmacists who teach in Nigerian universities, to sit down and come up with a product within 9 months. A product was developed at NIPRID. It was launched in Ibadan in November 2018. As I'm speaking to you today, no industry has taken that product to the market. So the problem is huge. We like imported things too much. We are all slaves to import. All of us. Everything we want is water. We are jumping up because somebody has removed patent. Patent for paracetamol has not been there for how many years? We are not synthesizing paracetamol here. You are talking of they have removed patent for COVID vaccine. It is true that when they remove the patent, India, that we call the pharmacy of the world, because India is a country. I've lived in India for years. Okay, so I can tell you, I did my postdoctoral training in India. So I can tell you that India, they are interested in making drugs. Local drug production is their thing. So they have the capacity, they have the wherewithal. Look, $6.7 billion is what the Indian government is waiting to use now. Immediately they give them the go ahead to go into this.
Right. Okay.
Production.
Well, let me
6.7 billion.
I think you were waiting to say
the Central Bank of Nigeria.
Yeah. We must give him a chance to speak as well.
Sorry.
You're making very good points, but let's hear what he has to say.
Yeah. So if we take a cue from what happened in COVID, let me use the diagnostic panel. You discover that before the pandemic, there are about only 2 to 3 institutions in Nigeria that can be able to diagnose COVID. Today we are counting them in 70s and 80s because we opened the window. You can see now that if you want to travel outside the country, you need to take a COVID test in a private lab. This is because before COVID, no private lab has capacity to actually diagnose COVID. Right. But there was window that was open. Now we have close to 20 labs.
And in fairness to you, it was driven by the central bank.
Absolutely. Yes. So why can't the same framework be used to establish? Nigeria was producing yellow fever vaccine for the whole of West Africa. Yes. We lost it in 1991. Why? So the Central Bank of Nigeria can be able to drive that process, create a platform for private sector to come in. In fact, not only COVID-19 vaccine, like the Serum Institute in India that he was talking about, they produce virtually 90% of all the vaccines in the world. So we need a platform, a government political will, and a framework that can be able to drive the process then the private sectors will key.
But why is it, though, given how important the health sector is and how profitable the health sector is internationally, why is it, because you talked about Nigerians loving things to come from abroad and the importations, and a lot of things have become successful because of partnerships between Nigerians and someone from abroad. Why hasn't that happened in the health sector?
Let me tell you, from experience, having been in charge of this particular space for some years, I can tell you, and this is what the industries will tell you. The owner of a big pharmaceutical industry in Nigeria told me, he said, look, Martins, to make ampiclox, to make ampicillin cloxacillin granules ready for reconstitution in Lagos, by the time I finish making it, and it is not in the market yet, it will be 480 naira. But our country, I'm quoting him now, our country allows that same finished product to come from China and from India, and when it gets to the pharmacy in the community where it is now ready to be bought by the customer, it is 80 naira. His own has not gone to the pharmacy. His own has not gone to the pharmacy. It's 480. The one that came from abroad has gone to the pharmacy. It's 80 naira. What do you want him to do? So everybody will dump research and development. Nobody will be interested in local drug production. Everybody will be importing finished products, and then then when they now say no aeroplane should fly again, we now sit down and start going to church and mosque to go and pray.
So, please come in, Dr.
No, sorry. You see, what the Central Bank of Nigeria has started, let if Emeje and the president should do what they can do,
right, okay.
They should not stop it.
I've got
if we
10
stop
seconds
it,
for you to give us the final word.
Yeah, my final words is we need a political will and a leadership to actually drive research and development.
And that's the key thing as far as you're concerned.
Yep.
Okay, Dr. Akyala Ishaku and Professor Martins Emeje, brilliant conversation, brilliant chat. Thank you very much indeed. Well, I'm afraid we're out of time, but I think you've made enough points, good thinking points. Thank you to both of you. You're watching the Arise interview, plenty more still ahead, including we'll assess the impact of COVID-19 on people living with physical challenges in Africa. Stay with us.